Wigger. Today I'm going to be doing an assessment of the peripheral vascular system. The tools you're going to be needing for this assessment are a stethoscope, a measuring tape of your choice. I just have a disposable one. And you also want gloves. You always want to wash your hands, don gloves. Your patient should be in a, if you're at home doing the assessment, they could be in a billowy t-shirt. That way you could be assessing the bare skin. Or if they're at the clinic, they can be wearing a gown. So, for this assessment is going to be so we're going to start from the top. What we want to do is assess the upper extremities, check for any kind of swelling. Swelling is considered abnormal. We don't want that. If you are not sure on, if one arm's maybe more swollen than the other, that's where the measure is. You always want to measure with using centimeters. And you want to measure, bringing the arm out, and I usually do it at the widest part of the arm on the upper, and then also doing it on the lower as well, if you're noting any swelling on the forearm. You want to do this bilaterally and check for any change or any difference in centimeters. So while we're looking at sometimes it can be cool depending on the temperature of the house, or just the patient's normal. And she has a nice pink flush tone to her skin, which is good. You also want to be looking at the hands, checking the fingernails for a nice pink flush, and her hands are nice and warm. A cool pallor, shininess of the arms, that could indicate some arterial insufficiency. Looking at the arms as well, we're going to start up here at the brachial artery. I'm going to check for her epitracheal lymph nodes. You want to take the hand as if you're going to be shaking someone's hand, and you're going to check in between the bicep and the tricep, the area in between the two, and checking for any nodules at all. So. While we're here, we're also going to be seeing the brachial artery. Brachial artery is found between the crease between the upper arm and the forearm. Usually when someone's taking the blood pressure, you'll see the nurse or the doctor put the bell in this area to check it. That's what they're checking for, and listening for. And that's what we're going to be doing here, is palpating that brachial artery. We want to do it bilaterally here. You can use the first 2 or 3 digits. A regular and even pulse. Pulses can be measured from 1 to 4. 2 is considered a normal, a nice regular bounding pulse. It's not too throbbing, and it's not too weak or thready, which would be considered a 1. Coming down the arm, we would also want to check the radial artery, which is located down the thumb line here. We could check her pulse right there. And we also want to check the ulnar pulse, which is following the pinky line, and checking on that side. Again, you can do this bilaterally by checking both hands equally, by doing the radial and then moving in and doing the ulnar. You want a nice, regular, even pulse. Again, a +2 measurement would be considered normal. Any kind of weak or thready pulse or absent of pulse should be followed up with. That's considered abnormal. Coming down, if you felt that either arm was insufficient, arterially insufficient, what we want to do is perform the Allen test. The Allen test is performed with the palm face up, and what we're going to do is have Laura put her hand in a fist, and we're going to squeeze or occlude the ulnar radial artery. We're going to do this for a couple seconds, and then Laura's going to release her fist. Doing that, you'll notice that the fist is fairly, pale right now because we're blocking the blood flow. And then, if you want to check the sufficiency of the blood flow of the ulnar artery, what you do is you let go and watch the blood flow come back to the hand. Comes back as a nice red or pink flush, and you know the hand is nice and warm. To check the radial blood flow sufficiency, what you want to do is the same thing. You want to occlude while the fist is clenched. You want to occlude, and then you want to have them open up the fist. And then to check the radial, you would let go of the radial pulse. You can do this on, you know, on one of the arms if you feel that one's more insufficient, or you can do it bilaterally, just to have a good comparison. So that completes the upper extremities, and we're going to come down to the lower extremities. Checking the lower extremities, we always want to have a good visual. We want to check for any kind of visual swelling. Look at the skin color. You know, note that she has a nice pink flush skin tone going down the legs. You want to look at hair distribution. For females, you usually want to ask, you know, if they still shave, if while they're shaving, if they're noticing any kind of patchy areas or shininess on the legs. For males, you can visually see if there's any irregular hair distribution. Typically, you want it going from nice and even down the legs, and then having possibly some hair on the toes. To check for swelling, if you are not seeing it visually, but you're suspecting some swelling, we could also do another measurement on the lower extremities. You want to do this starting with above the knee, and you want to measure, and then I would compare it with the left side as well. You want to do it above the knee, at the calf, and at the lowest part of the ankle. Okay, you also want to do it on the very top of the foot as well. Sometimes the feet can get swollen. So, and you want to compare. Typically, an abnormal finding would be a 2 centimeter difference with the a calf, or a 1 centimeter difference with the ankle. So, we're going to have Laura lay supine to assess further. What we're going to do is check the femoral artery, the nodules up, the superficial inguinal nodules located in that area as well, the popliteal artery, and the pedal pulses, the dorsalis and the tibial. So to check for the superficial inguinal nodes, what we want to do is have her bring the leg out laterally and press in towards the upper thigh, towards the middle. Okay? And we're going to press in and feel for those nodules. And you'd want to do that on the right side of the leg as well. You always, always, always want to compare. The next thing we're going to be looking for is the femoral artery. So you want to press in towards the groin and find that artery. And check for, you know, a regular pulse. You don't want it to find it absent or weak. So, and if you're having a hard time finding it, palpating it, sometimes you do. We can always listen for that pulse. Abnormalities typically found are the absence of the pulse, or if you're hearing any kind of bruise, or that like swishing noise. So, all right. Coming down the leg, we're going to check the popliteal pulse, and we do this by putting our thumbs up on the knee, and we're going to bring our 2 or 3 digits down below, and we're going to, press in on that behind the knee. Doing that, we should be able to feel the popliteal pulse. Okay, and if we're having a hard time finding it, our patient can always lie prone, or get prone, lay on the belly. And you can always find it by pressing in on the back of the leg this way. And it's good because you can do it bilaterally then, and then really get a really good comparison. Again, we're always looking for a regular and even pulses. Alright, go ahead and lay back supine. Thank you. And then coming down the legs, what we're going to do is assess the pedal pulses. So pedal pulses are typically, there's 2 of them. There's the dorsalis, which can be found off to the usually off to the lateral side. And you never want these pulses to be absent. If you are having a hard time finding these pulses, I suggest you get a Doppler and try and find them that way. And again, you're feeling for the strength and the regular pulse, a nice even pulse. And we're going to check for the tibial pulse as well. Okay. All right. And then another thing that we can do is same thing with the fingernails is looking at our toes. We can always check the capillary refill of the toes.